New at 5, a Jonesboro hospital is using robotics to get people back on their feet again. Brian Koleski spoke with a surgeon today and got a first-hand look at the technology. He's live at NEA Baptist. And Brian, what can you tell us?
Good evening, Diana. Dr. Eddie Cooper and his surgical team here at NEA Baptist are the first in Northeast Arkansas to use Mako SmartRobotics for hip replacement surgery. He says it's a game changer, and walk me through how the technology works.
One of the unique things about this system is that we take a three-dimensional CT scan of the socket, of the patient's socket. So we know exactly what the patient's anatomy is.
That scan helps Cooper figure out precisely what kind of implant is required and adjust it to the patient's range of motion needs.
To see if your hip's going to be stable throughout your normal activities. We can also determine how much bone to take based on that, so that you have a minimal bone resection. When we did that first case, of course we planned it out, we had looked at the simulation on the computer, and with the Mako robotic technology, we were able to put the socket in exactly the place that we had planned.
A lot of that planning happened before Cooper and his team stepped into the operating room.
The team was prepped, and they had been trained by the Mako staff, so they knew exactly what their task was. We were really confident that it was going to be perfect. Now, I was able to use my normal approach to the hips.
That planning not only relieved stress on the medical staff, Cooper said it also reduced the patient's loss of bone during the procedure and maximized their return to function.
No way that you can be as precise as this robotic technology can be, and so we're excited to be able to deliver that.
This technology can also be used for knee replacement surgery. Dr. Cooper said about 60% of all joint surgeries are done with the help of robotic technology, and he's excited to be able to use it more. Live from Jonesboro, Brian Koleski, K8 News.
That is fascinating. Thank you, Brian.